Hi there. This is Dr. Rahul Sen, consultant obstetrician. Today, I'll talk about planning for pregnancy. This is a very natural process. Now, yet people are getting so much anxious that even before their first conception, even they have not tried that much, they're rushing to the fertility clinics. This is totally unacceptable, uncalled for. It's a natural process. So I'll tell you how to try for a pregnancy naturally, normally. Now, you ask me, is there any right time for conception? Right age for planning for pregnancy? If you ask me, I say no. You can try any time during your reproductive period of life. For example, teenage pregnancies. Yes, these have problems, but there are certain advantages. At teenage, people rarely have diabetes, blood pressure, age related disorders which can affect the pregnancy. On the other hand, when you reach towards the end of your reproductive period, for example, beyond 35 years of age, these lifestyle disorders may be there may be problem. But then again, at 36, 37, 38, people are having their second, third pregnancies successfully. A former Prime Minister of England had his fourth child when his wife was 44 years old. That was a natural conception. It was not IVF. So you can try any time, but nowadays people are trying quite late. This is because of many social career restraints. You may ask me how to plan for this pregnancy. How do we go for it? Now, remember, one date is very important. That is the first day of your last menstrual period, which is called LMP. Now, you start counting from that day. It doesn't matter when the period stops, but write down on your notebook the first day when the period has started and go on calculating from there. The egg is usually released around 14th day after the LMP. But it can be released even as early as 8th day or even as late as 25th, 26th day, especially if somebody has a irregular cycle. Now, once the egg is released from the ovary, it's immediately picked up by the fallopian tube. And here it rests or waits for 24 hours for a sperm to come. Now, a sperm, when released in the mother's body, it stays alive for example 3 to 4 days. But the ideal scenario to have a pregnancy is when the egg is released, there are already sperms around it. Now, for that, you have to stay together regularly. That means you have to be sure that when the egg is there, the sperms are already there. There's a simple formula for that. If you ask me, I would rather say stay on alternate days throughout the month if you're planning for pregnancies. Now, if that is not possible, then at least on alternate days from 8th to 24th day. That is from the first day of the LMP. Now, this is the most important factor to become pregnant. So you have to stay together regularly. Now, many of the couples come to me and they say that we are trying for a long time and it's not happening. I find out they very irregularly stay together. In that case, it won't happen. I remind you once more, the egg lives only for 24 hours. Its lifespan is only 24 hours, and actually, it allows fertilization for only 12 hours. So staying together regularly is the prime important factor to become pregnant. In my next videos, I come to other topics on this planning for pregnancy. See you soon.